I, as before, have done some CME events for pharma companies. This isn't going to be a super pharmacology focused talk, but I will use generic names where I can. So I just wanted to talk a little bit about the spectrum of anxiety presentations that I've been seeing and I've been hearing about in the context of COVID. And it really is quite a spectrum. So I think there's, as I talked about before, a lot of normal reactions that look like anxiety. And I'm seeing that, I treat a lot of RCMP and police. And so when I hear about, people having anxiety reactions to kind of arresting people and being really face-to-face contact and not having a mask on, I view that as kind of if you're having anxiety that you could have COVID, then that would be in my mind a normal reaction. And so the interventions I take for that anxiety look very different than some of the interventions I take for like illness anxiety disorder. And so for those police officers, I'm kind of saying like, let's talk to your union reps about kind of PPE protocols. A step kind of further along the spectrum from normal reactions I would consider as an adjustment disorder, where perhaps somebody hasn't typically struggled with anxiety. They're having pretty specific anxiety about COVID or some other COVID related stressor. I'm seeing a lot of financial adjustment disorder related to financial stressors right now, or workplace stressors or those types of things, where the idea would be that if it were not for this stressor, they'd probably be kind of functioning well, but there is some impairment in functioning when we see an adjustment disorder. Health anxiety is kind of an umbrella term. It's not a DSM diagnosis, but in the literature, it's kind of in the umbrella term that includes illness anxiety disorder, where there's anxiety that's very kind of preoccupied specifically around health. And so I'm going to talk a little bit more about that today specifically. The other thing I'm seeing a lot of is exacerbations of underlying anxiety. So somebody who has pre-existing kind of anxiety disorder of some form that was previously well managed on a medication regime or a therapy regime, and they're no longer well managed. And so I'm getting lots of calls on Specialist Link about how do we optimize medication when the medication regime was working previously. And so we're doing lots of kind of problem solving in that regard. And then illness anxiety disorder is something that I have been seeing more of in the context of COVID. So I thought I'd talk a little bit more about some of the resources we can use to try treat that. But I'll start with just kind of the first part of that spectrum, the kind of more typical stress response that we're seeing. And I think you've probably heard a lot about this, so I'm not going to overly belabor it. We're getting a little bit more data, and by data, I mean consensus among experts, not that this is necessarily coming from a lot of randomized trials, that we should be minimizing media exposure, really relying on kind of reliable, trusted kind of government or healthcare organization resources, and trying to really maintain social connection while we're engaging in this physical distancing, among many other kind of standard mental health and wellness kind of recommendations. I thought I'd highlight we're getting some specific research on some of these mental health and wellness recommendations now in the context of COVID. So if you've heard me speak before, you've probably heard me talk about the benefits of mindfulness. Now we're getting a little bit of data specifically around the benefits of mindfulness in the context of stress response to COVID. So it's a small trial, but they were able to show in this randomized trial that the group who did daily mindfulness practice had reduced daily anxiety scores and had improved sleep duration compared to the groups randomized to non-mindfulness conditions. So if you're wanting to encourage your patients to try mindfulness, this might be an additional kind of encouragement that you can share, that there is some data even in COVID around it. And then on the more kind of severe end of the spectrum, I wanted to talk a little bit more about health anxiety and potentially specifically illness anxiety disorder, because it's something that I think is seen a lot in primary care. And I think a lot of us are seeing it at a more intense level since COVID has kind of been taking off. So the core features of illness anxiety disorder are really this anxiety that is about acquiring or having some sort of medical illness. And it's um, usually in the context of having like a normal physical exam. And these patients with illness anxiety disorder tend to not present with a lot of somatic symptoms like they do in somatic symptom disorder. So they tend to be predominantly presenting with anxious distress about illness. Is kind of the presentation, and it tends to be a chronic illness. So it would be perhaps unusual for somebody to have never had kind of excessive anxiety about their health to all of a sudden have a very narrow focused illness anxiety around COVID. What we've been seeing more is people who've had a tendency towards illness anxiety really having significant exacerbations right now, and some disabling worry about acquiring COVID. So there's some general management principles for illness anxiety that I thought it would be helpful to review. I won't go through all of them in detail, but I wanted to highlight a few. One of the things that we often talk about with illness anxiety is that it can be really helpful to schedule regular visits. And so not to necessitate that a new symptom or a new concern arise to have a contact with somebody's primary care physician, but that they're kind of scheduled as a check-in regardless of symptomatology. That strategy has been shown to be helpful. And really just wanted to emphasize the importance of the therapeutic alliance with people who struggle with illness anxiety. And that these folks might be folks that we spend a little bit more time engaging in kind of building that therapeutic alliance, because we're going to want to be able to leverage that to help kind of provide reassurance over time as well. The other important kind of tenet of treating illness anxiety is we want to make sure that we're finding ways to acknowledge the distress and validate the distress. So often people with illness anxiety disorder feel quite invalidated by the healthcare system. And so one of the ways that we can kind of effectively manage illness anxiety disorder is finding a way to validate their distress and their fears without necessarily agreeing with the kind of disproportionate risk that they might view themselves as having a specific illness. Another really important element of treating illness anxiety disorder is we want to treat the comorbid psychiatric disorders that might be present. There's often another anxiety disorder that is present. And as you'll see in a moment, we don't have a huge toolkit to treat illness anxiety disorder. And so if there is a comorbid disorder, we're going to want to treat that as kind of aggressively as we can, because we likely have more tools at our disposal in treating those comorbidities. And then the last piece I just wanted to highlight is, especially for patients who have insight that their anxiety about the illness is excessive, providing education can be a significant intervention that actually can create a lot of insight. And so I wanted to share one resource with you guys. So this is the Center for Clinical Intervention. This, if you're not familiar with it, is a CBT-based self-help website that's sponsored by the government of Australia. And they have a workbook and information sheets on health anxiety, which are CBT based and are fantastic. So we've been handing these out or recommending these a lot in recent weeks for people who are struggling with health anxiety. I just want to highlight that in terms of our treatment approach, it's really focused predominantly on therapy, cognitive behavioral therapy, or sometimes acceptance and commitment therapy. Or mindfulness-based therapy. Antidepressants considered third line, though we often use medication to treat those comorbidities, as I mentioned. There's pretty limited data in terms of specific medication choices. There's some trials that involve fluoxetine, paroxetine, and Luvox, but I would say if you're treating another comorbidity with another medication, I wouldn't switch to one of these just to treat the illness anxiety disorder. And then the last thing I just wanted to highlight is that I think the impact of the ongoing support from a family physician, particularly where there's a strong therapeutic alliance. I think that can be one of the most powerful interventions in managing any of these conditions. And so I just wanted to kind of highlight how important I think that is, and the great work that people are doing and kind of in offering ongoing support in such a difficult time.
Great, thanks very much, Amanda. And I guess a couple of the things that, a couple of the points that you made, I'd highlight. One is that short, brief check-in contact. Often we get overwhelmed by these patients' anxieties, and so having those short, quick visits, I think is a real pearl in what you've said. And the illness education, I'll often find myself talking out loud and saying, well, COVID usually has this and it usually has that, and your symptoms have been here. And so almost talking out loud and reassuring them, this is why I don't think it's COVID, or this is why I know that it isn't. So, great pearls, and certainly they spoke to me clinically. As usual, thanks very much, Amanda, for tonight, and also your ongoing contribution to primary care and the support that you provide.